So this video is about a very common bone condition called osteoporosis. Hello everybody, I'm Dr. PK from DrPKLyfe, and today we are talking about osteoporosis, a very common but silent bone disease. Many people don't even know they have it until they suffer a fracture. Recently I had a lady who was crossing a highway in a hurry and she snapped her femur, and she was taken to ER, and they told her that she has severe osteoporosis and that would cause her fracture. So I thought maybe I should create one video for you guys and explain it exactly what it is. Osteoporosis means porous bone. Your bones are living tissue. Old bone is constantly broken down and new bone is built. When bone breakdown happens faster than bone formation, bones become weak, thin, and fragile, and this increases the risk of fractures of a spine, hip, and wrist. Even a minor fall, sometimes just bending, coughing, can cause a fracture. I mean, it's unbelievable. Sometimes people don't even realize that they have a fracture and they just have some back pain and some difficulty in breathing and some pain in the mid upper back area, and they have a fracture on workup. So osteoporosis can affect anyone, but here the risk factor: women after menopause due to lack of estrogen, older adults, age-related bone loss because of lack of activities, family history of osteoporosis. Your mom had it, you're at high risk. Low body weight or poor nutrition, of course, because you're not well nourished. Vitamin D, calcium deficiency, they are foundation of your bone structure, calcium and vitamin D. Smoking and excess alcohol use, they cause more bone turnover and less bone formation. Long-term steroid like prednisone and sedentary lifestyle. Men can also develop osteoporosis, but not common. I remember one case who I'm dealing with recently who has osteoporosis, and we're still trying to figure out what's going on with that patient. Osteoporosis is a silent disease. Most people don't have any symptoms until fracture occurs. Sometimes there is a loss of weight. They have a stooped posture, hunchback situation, sudden back pain. I remember my father's aunt um, from his dad's side, and all my life I remember she was hunched back completely, and I mean later on I found out that she had a severe degree of osteoporosis. So lots of places, particularly in countries where there's no prevention, and old times where there was no primary care involvement, and people was not they were not even aware about osteoporosis. They thought it was just a normal part of aging. But good news is osteoporosis is largely preventable. Good nutrition, calcium rich food, leafy green vegetable, almond, dairy, adequate vitamin D, sunlight exposure, enough protein, weight bearing exercises, walking, jogging, some strength training, balance exercise to prevent falls, and no alcohol, no smoking, and maintaining a healthy body weight. Bone health should be protected from childhood onward, not just an old age. Treatment: osteoporosis is diagnosed with DEXA scan, simple x-rays, and that really tells us the score. Um, Depending on the severity and the fracture risk, you may need calcium, vitamin D, medication like Actonel or Fosamax, bisphosphonate category. They reduce bone breakdown. Um, and then there are other agents, they stimulate bone formation like a Prolia, and you have to take an injection every 6 months. Fall prevention is very important. Vision correction, make sure you remove the clutter from your home. That's very important. Loose rugs is one of the most common reason elderly people fall in their house. Improving the lighting and ventilation. Treatment is long term and must be monitored by a physician with a yearly, every 2 yearly DEXA scan, and checking your calcium level and vitamin D level in your body, and yearly or 2 yearly DEXA scan. Um, So osteoporosis is common, silent, but preventable and treatable. Strong bones gives you independence, mobility, and quality of life as we age. It's basically a framework of your body, and if the framework is broken, you won't be able to live a very comfortable life. So if you're over 50, postmenopausal, have risk factor, talk to your doctor about the bone health and screening. Like, share, and repost and subscribe. Thank you for watching.